guys, this is Dr. Hub. Today we'll look at the WHO proposed the multi-drug therapy, and this is for the treatment of leprosy. So first is in case of adult, what is done? In adult, we administer rifampicin, and this will be 600 mg and once a month. This is once a month. Then comes the addition of the clofazimine. There is clofazimine, and this is 300 mg. It is given once a month. It is once a month, and also 50 mg daily. It is also given 50 mg daily. Next is the presence of dapsone. Dapsone is given about 100 mg, and it is given daily. So what will be the duration of treatment? So duration of treatment, it will be 12 months in terms of the multibacillary and 6 months in case of the paucibacillary. Then we move on to the category of children. Here it involves the rifampicin. This will be 450. So as we move on to children, the doses decrease. It is 450 and it is once a month. And next is clofazimine. Clofazimine is given 150 mg. This is once a month, and also 50 mg. 50 mg alternate days. Next, we also add the dapsone. So dapsone is given around 50 mg, and this is given daily. So what will be the duration of the treatment? This is going to be 12 months in case of the MB, that is multibacillary, and 6 months, this is in case of the paucibacillary. Next we move on to in case of children, and this is less than 10 years old, or there is another category that is less than 40 kgs. So this is a category. So what are the drugs? Drugs which are included are rifampicin. This is nothing but 10 mg per kg. It is given once a month. Then there is also presence of the clofazimine. The clofazimine is about the 100 mg. This is given once a month, and also 50 mg twice weekly. Other thing to note is there is also the dapsone. Dapsone is about 2 mg per kg, and this is given daily. So what will be the duration and the treatment? Duration is 12 months in case of the multibacillary and 6 months in case of the paucibacillary.